So this is FMGE CBT questions. There are 5 questions in this particular paper. I am Dr. Sachin. I'll be discussing the psychiatry questions asked. So the questions have been framed. The first question is, which of the following is not suggestive of a medical cause of a mental illness? Mental illness, that is psychiatric illness, mostly don't have a medical cause. They are functional disorders, functional, not organic. Organic means medical cause. So they are asking, how do you differentiate a functional disorder from an organic disorder? Functional disorder are more common in young age, organic are more common in elderly. So the first point is towards medical. Acute onset is towards medical and gradual onset is towards functional. Loss of consciousness is more towards medical. Auditory hallucination is more towards a functional etiology rather than an organic etiology. Auditory hallucination is more towards functional. Okay, have a look at this chart. The difference between organic mental disorder and functional mental disorder. Organic means disease arising due to brain lesion, that is medical cause. Functional means no such basis. Acute onset is towards organic, gradual onset is towards functional. Organic is more towards old age and functional is more towards young age. Impairment of consciousness is more a sign of organic rather than functional. Please remember this point is very important. Visual hallucination is more towards organic and auditory hallucination is more towards functional. Okay, delirium, dementia come under organic and schizophrenia, bipolar disorder, etc. come under functional. Okay, this was the first question. Second question, very simple. Asked in previous FMGE, continuous rigorous washing of the hands. Continuous rigorous washing, OCD. Straightforward question, a definition. OCD, continuous rigorous washing of the hands. Obsession is a thought in which you feel your hands are dirty, and in order to counter that thought, you repeatedly wash. Repeated washing is known as compulsion, obsessive compulsive disorder. Straightforward question. Okay. Third question. Which of the following is the most common symptom of narcolepsy? Narcolepsy is a hypersomnolence disorder characterized by the tetrad of daytime sleep attacks, hypnagogic hypnopompic hallucinations, sleep paralysis, and cataplexy. Cataplexy means loss of tone on emotional events. Out of this, the most common symptom is daytime sleep attacks. Most common symptom is daytime sleep attacks. Okay, daytime sleep attacks. The other symptoms are hypnagogic hypnopompic hallucination just before going to sleep and hallucination just after waking up. Cataplexy, loss of tone on emotional events, that is fall while laughing. Okay, loss of tone on emotional events. Then sleep paralysis. Okay, so the 4 symptoms are narcolepsy tetrad, sleep paralysis, hypnagogic hypnopompic hallucination, cataplexy, and sleep attacks. The most common is sleep attacks. This is a NEET PG question, but I have kept it under FMG CBT because many questions do overlap. Women would get anxious, mood swing, occasional sleep disturbance, waking episode referred from obstetrics after 5 days. This is postpartum blues. There are 3 conditions: postpartum blues, postpartum depression, postpartum psychosis. Postpartum blues usually you'll get days history: 2 days, 3 days, 5 days, 7 days, less than 10 days. Low mood less than 2 weeks, labile mood, and no treatment is required in case of postpartum blues. No treatment. It is a self-limiting condition. Then comes postpartum depression. Onset is within a month of delivery. Low mood more than 2 weeks. Plus guilt, anhedonia, suicide attempt, antidepressant are required. And postpartum psychosis is depression plus delusion against the newborn. This child when grow up might harm my family, so better to kill the child, so chances of infanticide. Here we give antipsychotic and antidepressant and mother to child separation. So this chart you are supposed to remember. There are 3 conditions: blues, depression, psychosis. Blues less, then more depression, then more psychosis. Fifth and the last question. A patient has taken lithium for some months, discontinues it and says, ocean needs a sail, rat needs a tail. Write your exam and don't fail. Results will be out in a mail. Sail, tail, mail, fail. Rhyming, clang association. When words are linked to each other by rhyming. Okay, sail, tail, fail, mail. It is not flight of idea. In flight of idea, there's a one word connection. It is not tangentiality, because in tangentiality, the person loses the track, but there's no rhyming association. Not neologism, because no new words are used. Right? So these are the 5 questions asked. Hope the video is helpful for you. I have kept it as crisp as possible with the basic explanations. Okay. Wish you all the best for FMG exam. Thank you. Bye bye.